If you're a caregiver for an older adult, you know this question. I mean, you live this question. It's the one that pops into your head at the most random times and definitely keeps you up at night. Is this new thing I'm seeing, is it just a normal part of getting older, or is it something more? Well, today we're going to get some clarity. Let's figure this out together. And that worry it's just so real, isn't it? You're watching for changes like a hawk, absolutely terrified you're going to miss that one little thing that really matters. You hear the clock ticking at 3 a.m. and your mind starts racing. Is that a sign of UTI or just what they call a weak bladder? You're basically living in this constant state of high alert. Because that's the real goal here, right? It's not about trying to stop worrying completely. I mean, come on, that's impossible. It's about channeling that energy, that vigilance, into something productive. It's about knowing when it's okay to just keep an eye on things and when you need to pick up the phone and make that call. And that's exactly what we're going to cover, giving you a framework to worry smarter. And this right here is the absolute truth of it. We can't turn back the clock, but what we can do is become expert observers. Seriously. Knowing the difference between a predictable little change and a big red flag, that is the most powerful tool you have in your toolkit. It moves you out of that constant state of anxiety and into a place of action. Okay, so let's get practical. We're going to kick things off with a triage guide. Think of it as a clear, at-a-glance cheat sheet to help you decide your next move when you see a change. Okay, now take a look at this, because what's so helpful here is how it draws a really clear line in the sand. So for balance, yeah, walking a little slower is pretty normal, but sudden dizziness or any fall at all, I don't care if there's no injury, that's a red flag. For bladder control, having to go more often, expected, but sudden total incontinence or pain, nope, not normal. That could easily be a UTI. Same thing for skin. Thin, kind of creepy skin is just part of aging, but a red spot that doesn't fade when you press on it, that's a huge warning sign for a potential pressure sore. And with sleep, waking up earlier is common, but being so tired during the day you can barely function, that's a red flag. This guide right here is your first line of defense. All right, so now that we have that general guide, let's zoom in. Let's talk about the specific changes that should always get your immediate attention. These are the things you never ever just brush off as, oh, they're just getting old. So here's the deal with memory. Forgetting a name and then remembering it later, misplacing your keys, we all do that. That's normal. But what we're talking about here is memory loss that actually disrupts daily life. Asking the very same question over and over again 10 minutes apart. Or getting lost on the way to the grocery store they've been going to for 30 years. That's different. Remember, dementia is a brain disease. It is not a normal part of aging. Okay, this one is urgent. If your loved one suddenly, and I mean over just a few hours or a couple of days, becomes confused, this is not dementia setting in. This is most likely something called delirium, and it's a medical emergency. It's often caused by something totally treatable, like an infection, a UTI is the classic culprit, or even just being dehydrated. You see this, you treat it as an urgent call to the doctor, period. This number is your guideline, 5%. If a person loses 5% or more of their body weight over 6 to 12 months without trying, that is a major red flag. So, for a 160-pound person, that's only 8 pounds. It might not seem like a lot, but this kind of weight loss is linked to a much higher risk of getting sick, of falls, of disability, so it absolutely needs to be checked out. I'm going to say that one more time because it is so important. Falls are not a normal part of aging. We have this cultural idea that, well, old people fall. No, it's the #1 cause of injury for older adults, and the truth is, most falls can actually be prevented. So when we see the warning signs, we have to act. And here's exactly what to look for. Are they having those little whoops, near misses? Has their walk changed? Is it more of a shuffle now? Are they suddenly reaching out and grabbing onto walls or furniture to stay upright? All of these are signs that there's an underlying issue. Could be with balance, medication, vision, that a doctor really needs to look at. This might be the single most important slide we look at today. If you even suspect a stroke, you have to act fast. So F is for face drooping. A is for arm weakness. Ask them to raise both arms. Does one arm drift down? S is for speech difficulty. Is their speech slurred or just plain strange? And T is for time, to call 911. Every single minute counts here. And please, do not try to drive them yourself. Call for an ambulance right away. Look, it's completely normal to have bad days or to get frustrated with health challenges. That's just being human. But a major, persistent shift in personality, that's a red flag. We're talking about weeks on end of sadness, a new sense of hopelessness, or sudden things like paranoia or aggression. This isn't just a bad mood. It can be a sign of depression, anxiety, or another medical issue that can often be treated.
Okay, now we're going to get into a concept that's a bit more clinical, but it's incredibly helpful for caregivers to understand. It's called frailty. And believe me, it is way more than just feeling a little weak. So frailty isn't just a symptom, it's a recognized medical syndrome. The best way to think about it is like an orchestra where several of the sections are out of tune. The body's ability to bounce back from even minor things, like a simple cold or a little stumble, is seriously reduced because multiple systems just aren't working together correctly anymore. So researchers have actually defined frailty by these 5 criteria. You've got unintentional weight loss, measurable weakness in things like grip strength, constantly feeling exhausted, very low physical activity, and a really slow walking speed. A person with 1 or 2 of these is considered pre-frail, but someone who meets 3 or more of these criteria is officially considered frail, and they're at a much higher risk for bad outcomes. Okay, so we've identified what to watch for. Now, let's get down to brass tacks. What do you do when you see one of these signs? This is your action plan, because honestly, being prepared makes all the difference in the world.
When you spot a red flag, your anxiety can spike and it's hard to think clearly. So use this checklist. Before you even dial the doctor, jot down exactly when the symptoms started. Make a list of any new medications or changes in dosage. If you can, take their temperature or blood pressure. And finally, be ready to state the single biggest thing that's worrying you. This makes your call incredibly efficient and helps the doctor help you. And here's a great proactive habit you can start. Just once a week, take 60 seconds. Do a quick check of the skin on their heels and hips for any red spots that don't fade when you press on them. Check their hydration. Is their urine a pale yellow color? Dark urine can cause symptoms that actually mimic dementia. And just watch them walk a few steps. Notice any new shuffling? This simple little check-in can catch big problems early. As we wrap up here, I really want to leave you with a core idea about your role in all of this. It's something that can easily get lost in the day-to-day stress and hustle of being a caregiver. This right here is the heart of it all. The slow, gradual changes that come with normal aging, you can adapt to those. You can manage them. But the red flags we've talked about today, they are not something you just manage. They are signals. They are calls to action. Your observation is the very thing that can turn a potential crisis into a manageable problem. And finally, please always remember this. Doctors have the medical expertise, there's no question. But you have a different and equally vital expertise. You know their baseline. You know what normal looks like for them day in and day out. So after all the checklists and all the guides, never, ever discount your own intuition. You are the expert on your loved one. So what is your gut telling you? Trust it.